Welcome to 2025 Medicare seminar hosted by myself, Simon Chu, certified insurance counselor with 19 years of history, experience, and recognition with MDRT, with 26 years of recognition with National Association with Health Underwriting. Our agency currently have 4 office locations servicing everybody from San Francisco, Oakland, Fremont to San Jose. Our family comes with lots of history in the Bay Area, including my mom, Christina, who's been in insurance business since 1982, and myself started in the insurance business since 1989 to current, reaching 36th anniversary. And my son, Brandon, has been in our insurance agency for 10 plus years already. In addition to our team, I'd like to introduce our branch manager, Sunny. Miss Sunny is actually our Fremont branch manager who's been with our agency for 20 plus years. And Ms. Carmen is our Oakland branch manager who's been with us over 10 plus years as well. If you need more information about our services on our website, please go ahead and scan our QR code to the right, and you'll be able to learn more about our services and our credentials, along with our awards within the last 36 years of our agency in business. Briefly introduction on TV shows. I'm actually on TV every month, talk about financial topics as well as insurance topics. Each of these recognitions offered by insurance company with Allianz represent 10 to 15 million passed through my hands on an annual basis. And so each of these plaques represent 10 to 15 million of new money being invested with our agency. And this is the $1 Million Roundtable, top of the table award plaque showing I've been awarded since 2012 to current. And so again, as of right now, we manage over $100 million worth of funds in our agency. And you can rest assured that we can definitely take good care of your retirement planning. Now, in addition to investing, we also have lots of awards by insurance companies dating back to 1999. I was already named as one of the top #1 agent with Anthem Blue Cross. So you can see the plaques from Anthem Blue Cross, HealthNet, Aetna, HealthNet, Anthem. So a lot of these are some of the awards being displayed on my TV show when I specifically talk about Medicare benefits. Currently, we represent 11 organization insurance companies which offer 50 plus products in your area. And you can always contact Medicare.gov or 1-800-Medicare or your local state health insurance program for help with plan choices. Of course, you can seek the same service from our agency and our staff as well, and we can counsel you with what is appropriate plan for you to enroll into for your Medicare needs. Let's start with 2025 news. Basically, right now, if you are a Aetna Select member living in Santa Clara County, your plan is going to be terminated for 2025. We need to enroll you into a new plan. If you're currently enrolled in an Aetna Silver Script prescription drug plan, going into next year, it's going to be merged into the Choice plan. If you're currently with AARP United Healthcare Walgreens prescription drug plan, this plan is going to be terminated and you'll be merged into the Preferred plan. If you are currently an AARP United Healthcare HMO or PPO member currently residing in Alameda, Contra Costa, San Francisco, San Mateo, Santa Clara County, your plan is going to be terminated, except unless you are enrolled in a canopy plan, which you can continue. Otherwise, we need to help you enroll into a new plan. If you're currently enrolled with Brand New Day, this plan is going to be changing name to Central Health. Benefits, minor changes. However, your plan is not going to be terminated. It's going to continue. It's going to be renewed for next year, and the name changed to Central Health as an insurance company. If you're currently enrolled with WellCare HealthNet prescription drug plan going into 2025, all services will be provided directly with WellCare as they decided to discontinue commission payment to all agents in the U.S. So then they are basically asking members to contact WellCare directly if there's any related service needs in 2025. Last reminder, if you are currently having a Medicare card as well as a Medi-Cal card, we call dual members. If you are eligible for dual card and dual membership, we recommend you to enroll into an HMO plan. Otherwise, your county will force you into a plan may or may not fit your needs. Going into 2025 Medicare Part B premium, it's estimated at $185 per month. And this is usually taken out of your Social Security, or you're going to be billed by Medicare if you have not started your Social Security income just yet. Again, this is based on income as an estimate. By the time we record this recording, Medicare has not announced the exact amount. Again, this is just an estimate going into 2025. Now, let's go back to basics. When you have Medicare Part A and Part B, what does that cover? Part A covers hospital benefits, Part B covers outpatient services. When you have Part A and Part B, you need to enroll into a plan. Either on the left side, you'll see as an option 1, Medicare Supplement Plan, or on the right side, option 2, Medicare Advantage, also known as Part C. So let's go start with the supplement plan choice first. If you're considering into a supplement plan, you also need to consider having a Part D prescription drug enrollment as well. Otherwise, you will be paying a late enrollment penalty if you do not enroll in a Part D plan on a timely manner. So keep in mind, if you enroll into a Medicare supplement plan, you are also required to enroll into a Part D plan. Otherwise, you'll be paying penalty when you enroll in the future. On the right side, the Advantage plan, also known as Part C. Part C plan actually covers all of the Medicare Part A and B benefit. In addition, it includes prescription drug plan as well. And additional benefit can be included by specific insurance companies, such as dental, vision, transportation, acupuncture, and so on and so forth. And so those specific details on additional benefits, I will review specific plans within your county on all the key components within this plan. So again, when you have Medicare Part A and B, you have 2 options to select. You either select the supplemental plan on the left with a prescription Part D separately, or enroll in a Part C or Medicare Advantage plan, single plan that includes both C and D with additional benefits. So keep in mind of this photo when we talk about plan selections in later on of my presentation. Let's go over the enrollment period. There are a number of enrollment periods that you need to pay attention to. The first one's called the initial enrollment period, is when you first turn age 65. You have the option to enroll into a plan 3 months prior to your birthday, the month of, or 3 months after your birthday. But keep in mind, the effective date is the first of the following month when you enroll and process the paperwork. So I always recommend clients to process ahead of time. So again, the best to do is enroll prior to your birthday month. So that way your plan can start the same time as your Medicare Part A and B. That's called the initial enrollment period. The second one is called the annual election period. This is basically allow you to change plan once a year during October 15th to December 7th to take effect on January 1st. The next is called the open enrollment period. On January 1st to March 31st, you actually have one window opportunity to make plan change if you're using a new plan in this new year, the first quarter. Whatever reason you feel that that may not be a suitable plan, you still have one more chance to change during this period. It's called the open enrollment period. Otherwise, it's considered the lock-in period for the rest of the year from April to December 31st. Unless you have a special qualifying event, we call special enrollment, such as when you move your residence from one area, one service area to another out of the current county, you are also given an opportunity to change plan as well when you move into that new area. The second special enrollment is retirement. When you leave your employer-sponsored plan, you also have the opportunity to enroll at that time. Anytime during the year, you're allowed to enroll. So not necessarily have to go by the above enrollment periods. Low income subsidy, if you qualify for extra help from the government to help pay for your prescription drug benefit, that also open up a special window for you to change plans based on your need. The last one is your chronic health condition. If you develop a certain condition, that will also, certain conditions will also qualify for you a special enrollment, or you become dual eligible, meaning Medicare and Medi-Cal, having both a dual eligibility, that will also open up the opportunity for you to enroll as well. Let's talk about Medicare Supplement PPO plan. Now, remember at first, when I show you the Medicare card, this is the plan option on the left-hand side. We represent many insurance companies. The top 3 listed here are Anthem Blue Cross, Blue Shield, AARP, United Healthcare. Majority of clients would choose one of these 3 to select their Medicare Supplement plan enrollment. If you are considering Plan F or Innovative F, you may only be eligible if your Medicare is started prior to January 1st, 2020. If your Medicare benefit Part A and Part B starts after this date, you're not eligible for Plan F or Innovative F. You're only eligible for Plan G as one of the best plans to consider. Now, Plan G in 2025 is estimated to have a deductible of $257. Again, this is the estimate. By the time we record this recording, Medicare has not announced the 2025 Medicare Part B deductible just yet. So we're estimated at $257. This number may change, final numbers pending Medicare approval. The premium for this plan is approximately $129 a month. And this is a sample rate based on age 65, enrolling with Blue Shield in San Francisco. You're eligible for the first year discount. At the same time, this plan, again, Plan G Medicare Supplement are age rated as well as area rated. So if you live in different county, then your rate may be different with different insurance companies. And many of these companies offer the first year premium with discount, $25 off the first month. For the first year, for the first 12 months, I shall say. So that is a discount being offered at $25 off. Now, in addition to Plan G enrollment, you also need to enroll in a Part D prescription drug plan. So Part D is a lot of choice available. I will talk about that in later slides. Prescription drug coverage, just want to mention a few highlights. The first one is pharmacy network. Pay attention to specific pharmacy network. Every plan may have a preferred or standard or mail network for you to pick up your prescription. Typically speaking, preferred networks are lower cost than standard network pharmacy. So pay attention to which ones are your pharmacy network. Drug formulary, it's a drug list that's approved by the insurance company. Make sure that the drug that you're taking is part of that drug list. Otherwise, it's not going to be covered. Tier formulary, meaning the drugs are all categorized by 6 different tiers. Tier 1 is considered preferred generic. Tier 2 is generic. Tier 3 is preferred brand. Tier 4, non-preferred. Tier 5, specialty. Tier 6, some of these routine maintenance drugs, very low cost. Some plans offer it, some plans do not. So pay attention to your specific plan. Late enrollment penalty is what I mentioned earlier. When you become first eligible for Medicare Part A and B, if you do not enroll into a Part D plan, later on, you change your mind, you want to enroll, you're going to pay a late enrollment penalty. And what this entail is 1% of the month national average cost of a monthly Part D premium will be added to your late enrollment penalty if you do not enroll on time. So I stress that make sure you contact as soon as you find out you're eligible for Medicare Part A or Part B. We must help you facilitate an enrollment into a prescription drug plan. Now, also pay attention to the following. Prescription drug usage may entail prior authorization, meaning that when you need a specific drug, that drug needs to get prior authorization for an approval by an insurance company before you can be prescribed. Quantity limit typically is 30-day limit. If you have special condition that requires more prescription than needed, then that also needs to be approved by insurance company. Step therapy is typically when a lower cost drug is being used initially to start your session, your treatment, and then progress on to more expensive drugs that consider step therapy. Transition fill is if you change insurance company from one company to another. In the beginning of the year, the first 30 days of enrollment, that the new company must allow you to continue to take your prior prescription from the old insurance company. And then again, if you need to continue that new prescription, which may require prior authorization, meaning you need to submit new approval to the new insurance company to continue to take that prescription going into the following year. Part D 2025 prescription drug plan choices. So pay attention. 2025, there's going to be an annual deductible of $590. There are some plans that you don't have to meet deductible, and I'll go below details. 2025, great news for all seniors. It's the maximum out of pocket. You're only limited to $2,000. So worst case scenario, you take a lot of drugs. You don't have to worry about anything beyond $2,000. So again, $2,000 is signed into law going into effect 2025, that all seniors do not need to worry about paying more than $2,000 for all the drug combined in single 1 year. Below, I listed a variety of different drug plan options for you to consider. First one is Aetna SilverScript Choice. I mentioned earlier that many of our Aetna SilverScript plans are going to be merged into this plan. Going into 2025, the monthly rate is $53.60 per month. This plan does have a $590 deductible and then followed by copay. So the next plan is AARP United Healthcare RX Preferred. I mentioned earlier as well that we have a lot of clients that currently enroll into the Walgreens plan, which will be merged into the preferred plan going into next year, paying $115.40 a month. This plan will not have a deductible. You simply pay copay based on the tier of your drug. So again, tier 1, 2, 3, 4, 5. Those are the copays. In addition to these two drug plans being the most two popular plans, there are others to consider. AARP United Healthcare RX Saver is going to be $124.80 a month, and then $590 deductible. There's WellCare Value Script, used to be 40 cents, going into $17.40 per month in 2025. WellCare Classic, $35.90 a month, going to be $16.80 a month. This will also have a $590 deductible. WellCare Value Plus, currently at $82.60, going into $117.60 a month. This, again, will have a deductible, but only applicable to tier 4 to 5. So again, tier 1, 2, 3 do not need to meet deductible. So that's WellCare prescription drug plan consideration. The following is Humana. We also represent Humana, $94 a month. Here's the deductible, applicable to tier 3 to 5, or going to the premier plan, $164.20 per month. No deductible, simply pay copay. So there are a bunch of prescription drug plans that you can consider, plus more, right? It's close to 100 plans out there. Which one's more suitable for you? These are some of the popular choices that we recommend. So you can consider that or consult with us for one specifically catered to your needs. Medicare Advantage plan. So if you remember, I mentioned earlier on the right-hand side, when you're eligible for Medicare, the Medicare Advantage HMO plans usually have a network that you need to stick to, a out-of-area emergency care only, or urgent needed services outside of the U.S. So these are being provided in the HMO plan. The restriction is you have to have Medicare Part A and Part B in order to be eligible, and must continue to pay Part B premium. So you must continue to have Part B premium be paid in order to eligible enroll, and also based on the county that you live in, determine what plans are being available to you. Premium range this year anywhere between $0 to $49 depending on your county. First of all, I'm going to head off introducing the San Francisco County 2025 Medicare plans. Now, if you live in other counties such as San Mateo County, Alameda County, Contra Costa County, and Santa Clara County, you can forward this video to later on of my presentation to see your appropriate county benefits, because I will be spending quite a bit of time for San Francisco because it is a huge county, has a lot of plan selections. So again, you can skip forward to the county that you live in to see your specific plan offerings. So first of all, I'm going to introduce Aetna Zero Premium, Anthem Zero, AARP United Healthcare Canopy, $49 a month, Alignment 0 and 48, Central Health 0, CCHP 21 and 0, Scan 0, and WellCare Health Net 0. So among all these, plus there's more than this, right? I only highlighted on some of the popular choices here. What I'm going to do is I actually sort them out for being the top 5, and then in this first screen, and then in the second screen, the other between 6 to 10. So basically, plan choice wise, this is based on popular demand, popular enrollment, the ranking as such on the left-hand side. First, we start with Aetna Select, Anthem Prime, Central Health, Alignment, AARP United Healthcare with Canopy. I go into specific to explain to you about the key benefit highlights, such as office visit, 0 copay for primary care, 0 copay for specialists, hospitals, $245 per day for the first 1 to 5 days, emergency rooms, $140, urgent care, 0. So you can see the benefits when you talk about office visit and you look across and see the other plans, how they stack up to the Aetna plan. Hospitalization, same thing. You can see across and see other plan benefits. And then the following benefits called the maximum out-of-pocket. That means worst case scenario that you as a consumer will never pay beyond this amount in a single year. So this is the maximum you need to pay out of pocket will be at this amount. $2,500 with Aetna. RX prescription drug plan, this plan does not have any drug deductible. You will copay as you need. So basically, again, 5 tiers, prescription tier 1, 2, 3, 4, 5. These are your copay amounts. Lab and X-ray is 0 copay and 0 copay. CT, MRI, 0. Transportation, 0. You're allowed 12 one-way for transportation. And this transportation can take you to your doctor's appointment, your lab work, maybe prescription refill, things like that as well too. So that is available with Aetna. Over-the-counter catalog typically is non-prescription drug, your daily usage for, cold, fever, vitamins, things like that. We actually have a catalog you can pick up from CVS as well as online order. Fitness gym, you can use 24-hour fitness, and you're actually entitled to additional allowance of $150 per quarter, applicable for other gym memberships. Or if you want to pick up other gym or fitness equipments, you can certainly do so with this $150 credit per quarter. Again, this per quarter. You can accumulate the benefits for multiple quarters to use in one single lump sum amount. So again, be sure to clear this amount every quarter. Acupuncture benefit, zero copay, unlimited using the American Specialty Health Network. Dental benefit, $1,000 available for using Aetna Dental PPO network. And then vision, if you use iMed, the optometrist, you can get the eye exam for free. And then you can use the $275 allowance for your frames and your contacts or your eyeglasses. Brown and Toland is the medical group along with One Medical with Aetna. So right here, basically, I want to point out Aetna being one of the top choice in San Francisco, along with Anthem Prime, Central Health, Alignment. I'm not going to read through every single box, but I do want to point out each of these carriers. What are the key significant difference among them or among others, right? So with Anthem Blue Cross, you'll see that the urgent care and emergency room copay is a little bit lower. And then the transportation, you'll see there's 61 way that you're allowed. So it's quite a bit. And then also the over-the-counter, it's got $100 per quarter. But the other disadvantage, of course, is the dental and then the acupuncture. Medical group-wise, pay attention. They do have Brown Toland, AAMG, and then NEMS, Northeast Medical Services. So if you use NEMS as your provider, Anthem will be the new carrier available to access NEMS going into 2025. But otherwise, if you need Hill Physician or Access or AAMG Medical Group, Central Health is the one that have contract with Hill Physician. Their benefit over the counter also is pretty rich at $129 per quarter. And then also transportation is 24 one way as well. And for hospitalization, it's actually pretty low, on $150 per day for the first 6 days. And then same with the emergency room copays and things like that. So this is also a really, really good benefit as well for you to consider. And then Alignment, use the My Choice Cal, and then the zero premium, use Brown Toland Medical Group, CPMC. And then the last one is the AARP United Health. We call it Canopy. So this is a $49 plan. It's not a zero premium. It's $49. This is one of the plans that allow you to use the Canopy network together with UCSF. So there are specific members that need access to UCSF providers and specialists. And so the Canopy plan will be a perfect fit for that purpose. So again, this is the Canopy United Healthcare plan with $49 a month. This is the second set of plans in San Francisco. You'll see that I listed out the Aetna Select plan as a benchmark plan just for reference. And then I list out Scan, Ally, CCHP Senior Value Zero Premium, WellCare Zero, and also Imperial Zero. So again, I'm not going to read through every single box, but I do want to point out the key difference why I list them out here as additional alternative choices for you to consider if you live in San Francisco. So the key thing is right here, hospitalization is $200 for day 1 to 5. And then for transportation, it's got 36 one way. And then over the counter, $155 per quarter. But this $155 per quarter is inclusive of both gym reimbursement as well as grocery and over the counter combined. So three things combined into one single amount of $155 per quarter. The other noticeable benefit is the acupuncture unlimited, and then the dental allowance actually up to $2,000. But there is a catch. In order to use this plan, you must use AAMG Medical Group. So AAMG, All American Medical Group, is the only medical group contracted for this particular plan. So again, if your physician is not in this medical group, then you cannot enroll into this plan. Okay, the following one is the Chinese Hospital, CCHP, Chinese Community Health Plan. And so Chinese Community Health Plan contract with Hill Physician and as well as Jade also. And then WellCare is contracted with AMG, NEMS, Northeast Medical Services, and Brown Toland. And the last plan is Imperial. So Imperial is a very, very small company. But one thing to notice is they do offer, being such a small company to be competitive with the big boys, they do want to offer a Part B rebate, which is $60 per month. So I don't know if that's important to you, but otherwise, The other noticeable benefit is the out-of-pocket maximum, which is $297. Really odd number, but it's super, super low. As you can see across the board here, no other company offers such low out-of-pocket as compared to Imperial. And also hospital stay, the first 90 days, zero copay. So you don't have to pay anything for the first 90 days in hospital. But again, the catch is because of the Imperial network, it is a very, very small network. So I caution you, if you really want to consider this plan, please be sure to talk to us. We need to counsel you further about the pros and cons of this plan. So far, I described all of the San Francisco County plan selections. And again, Aetna continued to dominate to be one of the top choice plans for many of our members that choose to enroll. And so I just want to bring that to your attention. Next, we're going to go into Alameda County. So if you live in other counties such as Contra Costa County, San Mateo County, and Santa Clara County, you can actually forward this video to following time slots so that you can skip through this county if you do not live in Alameda County. So again, I'm going to start with Alameda County 2025 Medicare plan selections. We have Aetna HMO, 0 premium, Aetna PPO, 0 premium, Anthem 0, Alignment 0, Central Health 0, CCHP 31 and 0, and Blue Shield at $49. It is going to be a PPO plan with Blue Shield. Scan is 0 premium. Next, we list out the Alameda County top 5 choice plan selections. Again, we use Aetna Select as a benchmark, Central Health, CCHP, Scan, and then Aetna Core PPO. Because there are a lot of Alameda County members that enroll in PPO because of physician network issues, especially Southern Alameda County. So we specifically list out this plan here for reference. So let me go ahead and start explaining about the Aetna Select plan because again, Aetna tend to be one of the top popular choice for a lot of members who enrolled in. So specifically, current members also had enjoyed Aetna benefits the last few years as well. So for office visit going into 2025, the Aetna plan 0 copay for primary care, 0 copay for specialists. Hospital is $245 per day for day 1 to 5, and the emergency room it's $140, and the urgent care is 0. Maximum out of pocket is $2,500. There is no drug deductible. You just simply pay copay based on your drug. Lab and X-ray 0, CT MRI 0, transportation 12 one-way with 0. Over the counter is $75 per quarter using CVS or online order. Gym and fitness, you can use 24-hour fitness with Silver Sneaker, and you get an additional reimburse of $150 per quarter. And again, it has to be clear every single quarter. Again, you cannot accumulate multiple quarters to use. Acupuncture service, 0 copay, unlimited using the American Specialty Health Network. Aetna Dental PPO at $1,000 allowance. iMed Vision, if you use iMed optometrist, you can get your eye exam for free, and then you can use $275 toward your eyeglasses and eye frames or contact lens. Brown and Tolan Medical Group is the one to use together with One Medical. So again, Aetna, I list out here as a benchmark plan comparison to start with. And you can take a look at Central Health as well for a number of reasons because of your physician in different network. And then also the hospital copay is going to be a little bit lower, $150 per day for the first 6 days. However, CT/MRI is higher at $200 as compared to others. The transportation, you're allowed 24 one-way trip, and then over the counter $129 per quarter. Is a pretty rich benefit right here. Silver Script using 24-hour fitness plus a $60 per month allowance. Acupuncture limited to 30 visit. Basically Delta Dental Preventive Service. Vision, you get $300. The network basically is contracted with AAMG, Access, and then Hill Physicians for Alameda County. Now, the plan next to it, it's the CCHP. The CCHP expanded from San Francisco, San Mateo into Alameda County for 2025. You notice a little bit of difference in benefits. And the main thing to point out here is you notice if you have a hospital stay using the Chinese hospital, the first 7 days you pay $150. If you end up to be staying in other hospital, not Chinese hospital, then your copay is going to be higher at $250 per day for the first 7 days. And the other noticeable difference is the out-of-pocket maximum is $2,500. The other is CT/MRI, possibly up to $150. A transportation a little lower. The over-the-counter is $65 per month. It's still pretty rich. There is no fitness, and then there's $10 copay for acupuncture. Dental preventive service only. The main thing they are promoting is, of course, a Hill Physician Medical Group together with Sutter and Stanford. So that's CCHP expansion into Alameda County. Scan also is the next one that expand into Alameda County. And I do want to point out the key benefit over here. It's $100 per day in hospital stay for the first 5 days. The maximum out of pocket is only $1,500. That's pretty low as compared to other carriers. And then the transportation is 24 one way. That's also fairly rich as well. Over the counter benefit, it's okay, $75 per quarter. Dental against preventive only, vision at $200. They're only contracted one with Brown and Tolan medical group. So there's basically only medical group available for this plan. The last plan is the Aetna Core PPO. We have a lot of members currently enrolled into the Aetna Elite PPO plan this year. Going into next year, you are going to be automatically be enrolled into the Core PPO. No action is needed. Automatic converted to the Core PPO. Because it's a PPO plan, you are allowed to use in-network and out-of-network. So on top here, you'll see if you choose a PPO, Aetna PPO provider, then you pay $0 copay for primary care and $30 for specialists if it's in-network. If you go out of network, you're going to copay a little bit higher, $25 for primary care, $65 for specialists. So hospitalization is $345 per day, day 1 to 4. The maximum out of pocket, please notice as well, if you're inpatient in network, your out of pocket is $5,900. If you go out of network, it's much higher, $8,950. There is a $590 deductible applicable for drugs for tier 3 to 5. So again, tier 1, 2, you simply pay $0, and 3 to 5, you pay this $590 deductible, then you pay the copay. There's other difference noticed is the CT MRI, $200. Transportation is not covered, over the counter is not covered. $30 unlimited acupuncture benefit, dental PPO, $1,000. Eye exam only. There is no eye glassware allowance for this plan. So Aetna PPO network is the network to consider. So far, that's the Alameda County top 5 selections going into 2025. Next, I'm going to introduce Contra Costa County top choice plans for 2025. That would be if you live in San Mateo County or if you live in Santa Clara County, you can actually forward this video to the following sections: San Mateo County and then Santa Clara County to listen for your benefits, so you don't have to sit through this Contra Costa County benefits. So Contra Costa County will be very, very limited for 2025. There's going to be Central Health for 0 premium, AARP United Healthcare 59, Humana PPO 34, and then Anthem PPO 44 per month. So I list out the 4 plans side by side here for you to reference. Majority going into 2025, a lot of clients currently already with Central Health, and they for sure will consider, because this will be the only 0 premium plan in Contra Costa County. The only 0 premium plan, I repeat. So for a doctor's visit with Central Health, it's 0 copay for primary care, $10 for specialists. Hospitals, $150 per day for 1 to 6. And then maximum out of pocket is $24.99. So it's very, very low out of pocket as well. And deductible for prescription drugs is only $100 deductible for tier 2 to 5. And again, for tier 1, you simply pay 0 copay anyways. So overall, benefit-wise, you can see the benefit is much, much lower out of pocket compared to the other plans. Lab X-ray is 0, CTMI is $200. They're also very reasonable. Transportation is 24 one way, no copay. You can see no other plan offer this benefit. Over the counter is $129 per quarter, and this is the highest in Contra Costa County as well. Gym membership, you can use Silver Sneaker, plus in addition, $60 per month allowance for other usage as well. Acupuncture, you get 30 visits, 0 copay. Delta Dental for dental care, and then Vision with $300 allowance. The physician network is with Hill Physician and then also John Muir. So majority of clients in Contra Costa County use these 2 medical groups. This plan will do, and I'm pretty sure you will want to enroll and consider this plan as well, being it's a 0 premium plan and the only 0 premium in Contra Costa for 2025. Next, I'm going to introduce San Mateo County. So again, if you live in Santa Clara County, you can fast forward to Santa Clara County benefits. You don't have to sit through this San Mateo County benefit descriptions. Okay, so San Mateo County going into 2025, you will have Aetna 0 premium, Anthem 0, Alignment Sutter, Blue Shield 35, Central Health 0, CCHP 0, Scan 0, WellCare $37 with a $200 deductible. So this is a different compared to the rest of the plan. Now, I also list out the top 5 plans available in San Mateo County. I use the Aetna Select as benchmark. Great news. Aetna is expanding into San Mateo County. First time ever. Always been in San Francisco and Santa Clara County. Now San Mateo County, now you're in luck. San Mateo County residents have a additional choice with Aetna to consider. So I list out the Aetna plan as a benchmark as others compare to it. So in San Mateo County, the top 5 choice plan list out here is Aetna, Anthem, Central Health, Blue Shield is $35 a month, and then Scan Ally, this particular plan. So let me explain the Aetna Select plan with zero copay primary care, zero copay for specialists, hospital $245 per day for first to 5 days. ER copay is $140, urgent care zero copay, maximum out of pocket is $2,500. No drug deductible. You simply pay copay when you need to. Tier 1, 2, 3, 4, 5. Lab X-ray and CT MRI zero copay. Transportation you get 12 one-way for zero. Over the counter $75 per quarter using CVS. Gym membership you can use 24-hour fitness. You get an additional $150 per quarter to be used for reimbursement of other gyms as well as other fitness equipments. And in acupuncture, you actually get zero unlimited using the American Specialty Health Network. Aetna Dental PPO, you get $1,000 benefit. Eye Med Vision Provider, you can get eye exam for free. And can use $275 toward eyeglass wear. The medical group contracted is Brown & Tolan, and then One Medical. So this is specific to Aetna Select HMO plan, zero premium. Now you can see it's fairly rich benefit. I'm going to point out the key difference between the other plans. I'm not going to read through every single plan benefit. You can see them side by side, comparison across, when you see doctor, when you stay in hospital, the maximum out of pocket. So you can see the Anthem Prime for San Mateo County, the maximum out of pocket is quite low, $1,200. I think that is the lowest among all 5. But the other disadvantage here is the CTMI. It's $150 copay. There is no transportation. And then also over-the-counter is fairly low with $20 per quarter. Silver sneaker is also included. And the difference is the medical group. So Anthem is contracted with AAMG as well, together with NEMS, Northeast Medical Services. So if you need to use Northeast Medical Services prior to this year, you're not really given much choice. Now you can consider Anthem to use with Northeast Medical Services. Now, Central Health, which has been also very popular the last few years within San Mateo County as well. The key difference is the hospitalization. It's $150 per day the first 6 days. And then the disadvantage, of course, the CTMI is a little bit more expensive at $200. The advantage here is the transportation, 24 one way. Also, key advantage is the over-the-counter catalog, $129 per quarter. That's probably one of the higher ones here on this list. And then additional reimbursement, $60 for gym membership. The medical group usage is AAMG Access and Hill Physician in San Mateo County. Now, a lot of physicians, a lot of clients in the San Mateo County like to use the Palo Alto Medical Foundation because the doctor providers are only accepting Palo Alto Medical Foundation or Inside Medical, the PAMF network. So you have to consider to enroll into this Blue Shield Inspire plan, which is $35 a month. So it is not a zero premium. It's $35 going into 2025. Key benefit difference is hospitalizations, the $280 per day for days 1 to 5. Maximum out of pocket is $4,300. CTMI is $75 a little bit. It's actually middle of the road, not low and not high. 12 one-way trips available. Over the counter is $55 per quarter. And again, because you need to use the Palo Alto Medical Foundation network, this is probably the only plan available for you to consider in the peninsula. Lastly, I want to mention SCAN expansion into San Mateo County. So SCAN will be the first year going into San Mateo County offering this plan called the Ally. Ally is a specific plan contracted with One Medical Group, which is AAMG only. Again, AAMG Medical Group only. This plan does not accept any other physician except AAMG. But there are some key components here that's noticeable. One is the maximum out-of-pocket is $2,200 only. And then the transportation, you get 36 one-way. The over-the-counter catalog is $155 per quarter. So this $155 per quarter, including gym membership, as well as grocery and over-the-counter catalog benefits. So three things combined into one single amount of $155 per quarter. And then dental benefit, it's very high at $2,000 allowance, vision at $200. So once again, this is scan first year going into San Mateo County with a zero premium plan. Again, only contracted with AAMG. That's it. Only this medical group works with this particular plan. Okay. Finally, we're at Santa Clara County Medicare plans. So Santa Clara County 2025 Medicare plan selections, you have available of Aetna Plus 2 plan, which is at $46 a month. So if you're currently an Aetna member, you're currently on the Select and Plus with a zero premium plan, we actually have to re-enroll you into this plan. You do not automatically enroll into this plan because those two plans are being terminated for 2025. In addition to Aetna, you also have Alignment, My Choice 0, Alignment Sutter at $49, Anthem 0, AARP United Healthcare 0, Blue Shield 38, Central Health Plan 0, Scan 0, WellCare Health at $37 a month. Now, we list out the top 5 choices here for comparison's sake. We have Anthem Prime, Central Health, Alignment Sutter, and then Scan Classic. So these are probably the top 5 selections for a majority of clients going into 2025. And we use the Anthem Prime as a benchmark for explanation purpose. The office visit copay is 0 copay for primary care, 0 copay for specialists. Hospital is 0 per day for the first 90 days. So again, if you go into a hospital using this Anthem plan, you don't have to pay a dime for the first 90 days. Emergency room copay is 90 with urgent care 25. The maximum out of pocket is the lowest in this page is only $800. No prescription drug, no deductible. I'm sorry, no prescription drug deductible, and you simply pay copayment. So lab X-ray is 0 and 0, CT MRI is $50 copay. You get 60 one-way transportation for 0 copay. Over-the-counter catalog is $45 per quarter. Silver Sneaker, you can use 24-hour fitness. Acupuncture 24 visits, 0 copay. Dental allowance $750. Vision allowance $250. The medical group is Physician Medical Group of San Jose, and then NAMS, Northeast Medical Services. Northeast Medical Services will be the first year be included into the Anthem plan. So if you must use or you like to use Northeast Medical Services, this is the plan to consider to enroll. Next plan is Central Health. I'm not going to read through all the numbers and all the lines here. You can see them side by side comparison from one plan as compared to the other. I just want to point out the key difference within these plans, whether it's advantage or disadvantage. So the advantage is the hospital copay is only $150 per day for first 6 days, as compared to others a little bit higher, but also others are lower. The maximum out of pocket is $24.99. Is actually right there in the middle. It's not the lowest, it's not the highest, but the CTMI is $200 copay. Transportation is $24 one way, but over the counter is one of the highest at $129 per quarter for over the counter catalog. And then also gym membership as well. So in addition to Silver Sneaker, you're going to get $60 per month additional allowance for that purpose. And then dental, you use Delta Dental, Vision $300. Medical group, you will be using the PMG SJ, Physician Medical Group of San Jose, Soul Medical Group, and Center IPA. The next carrier is Alignment. So Alignment, noticeably, the hospital benefit is quite nice at 0 copay for the first 4 days, and then $100 copay for day 5 to 10. However, the out-of-pocket is a little bit higher. There is no drug deductible. This is only applicable to people with low income subsidy at a share of cost. Then there is a deductible. But otherwise, if you don't have share of cost, you don't have to pay a deductible. Lab X-ray, you don't have to pay. 12 one-way transportation. And then basically the medical group to use is SCIPA, Santa Clara County IPA, Physician Medical Group San Jose, and also NAMS, Northeast Medical Services, and with One Medical. So the physician network selection, it's quite comprehensive. Pretty much it includes almost all of the medical group, most of the medical group in Santa Clara County. So that's Alignment My Choice plan. The next is Alignment Sutter. So there are a lot of members that use the Sutter network. you have to enroll into this Sutter Advantage plan for $49 a month in order to access the Palo Alto Medical Foundation Network and the Sutter Network, and also the El Camino Health Network. So again, because it's costly to be contracted with Sutter, Palo Alto Medical Foundation, and El Camino Health, that's the reason why this Sutter plan costs $49 per month. And you can see through the benefits on this page. The next one is SCAN. SCAN is, of course, expanding into Santa Clara County. One noticeable difference is, of course, the copay for hospital. The first 4 days is $0. Then day 5 to 10 is $75 copay. Maximum out of pocket actually is second lowest on this page. It's only $1,200. And then also transportation is 32 one way. Over the counter is $100 per quarter. Also fairly rich as well. Acupuncture is unlimited. Dental preventive service only. Vision care for $300. Only one medical group available, which is Physician Medical Group of San Jose. So this is a snapshot of what's available in Santa Clara County, being the top 5 selection choices for our clients going into 2025. This Medicare plan comparison presentation is only a highlight of benefit. For plan-specific coverage, please refer to each insurance company's plan summary of benefits on Medicare.gov or 1-800-Medicare, or get additional information that best suits your insurance needs from our staff. Our agency can also provide you with all of those details as well. Thank you for watching our video. Now I'd like to move on to briefly introduce our other lines of services and offering to our clients. We also help you manage your retirement by having you move your 401k rollover, IRA, 403b, TSB, cash or CD equivalent. There are a bunch of promotions available right now with 40% bonus, 25% bonus with annual 250% annual index credit bonus, or a 9.5% guarantee rate as well. So these are all very attractive promotion plans available for you to improve and enhance your retirement income planning. In addition to that, we also offer bank match funding, where we can generate a tax-free retirement income for you, utilizing your funds and bank financing as well. So that's very, very attractive for many clients looking for a tax-free retirement plan. Thank you very much for watching our video today. If you're on Facebook or YouTube, please subscribe to our channel. iSimon888 on both channels. You can click like or subscribe. That way you'll get first notification anytime we post a video or make announcements for various promotions, financial planning, insurance company promos. You get the first-hand information. You can also click onto our website anytime, simon888.com, or you can call a toll-free number, 1-888-746-6688. If you watch Chinese television, I'm actually on TV the first and third weekend on Channel 26 in Mandarin at 7:30 p.m. Also on Chinese radio station AM 1400 and FM 96.1 Cantonese and Mandarin station, talking about financial topics as well as insurance topics. So once again, we have 4 office locations to serve you: San Francisco, Oakland, Fremont, and San Jose. Thank you very much for watching this presentation. We wish you the very best for your 2025 Medicare enrollment. Be sure to consult with one of our specialists to find the best fitted plan for your need. Thank you so much for watching our video. We wish you the very best for upcoming year.